brighter days ahead. This, of course, is the time of year when dentists say a lot of people start to think about whitening their smile, and the procedures and products that do this are getting better and better every year. But there could be some risks.
And let's find out more about it, because we want to talk about what's going on. And head of this dentistry situation is a doctor joining us tonight. We want to talk about white teeth and how people are all concerned about it. Everybody's out there. We got toothpaste, we have strips, and there are so many different procedures. But primarily, let's talk about the home way to do this thing. The benefits and the negatives. Let's talk about that, doctor. What's the best way to handle it at home?
The best way to handle it at home is a lot of people are either buying it over the counter or getting it from their doctors. They're getting the actual trays. If you're getting it over the counter, is great, but it just removes the stain from your teeth. It really doesn't brighten your teeth as well as the gels that the doctors give you, because the concentration is higher from what we dispense versus what's at the pharmacy.
Yeah, Dr. Fajiram, a lot of doctors, I mean, I should say, are recommending, you know, that perhaps maybe the home remedy is not the best. Maybe you should go to the dentist. Is that the best way to do it?
It is, because when you're not doing it under the supervision of a doctor, you can damage your gums if it's not done correctly. You're not sure if your teeth are healthy enough to use it, and you actually go ahead and use it. And if it's not done correctly, again, you can damage your gums, you can damage your tongue, you can damage a lot of the oral tissue in your mouth.
And how much is too much? We were talking about people being addicted to doing this if they buy the white strips over the counter or whatever it is, or even if the doctor gives them like a mold of their teeth and then they use it. How often is too often, and does that cause teeth sensitivity?
It does. It can create severe sensitivity if it's not done correctly. So we always say use it as directed. But patient, even though we give it to them and we tell them to use it every 2 or 3 months, or put it in the refrigerator, or use it before if you're going to a wedding or some big events, they still, because they have it, they abuse it. And they use it a lot. So it does cause severe sensitivity.
Yeah, Dr. Fajiram, a lot of people are also concerned about age, you know, how young, you know, and you have to be very careful with children. And also, as people do age, you know, there's a natural yellow effect to the teeth. So is the white teething for everyone?
No.
Teeth whitening for everyone?
No, it's not. You want to use it, you have to be at least 14 years and older. You cannot use it if you're pregnant. It's not recommended at all. And also, if you have yellowish into your enamels, it's great to use it. But if you have gray teeth, or if you have bonding, if you have veneers or different like crowns, you don't want to be using this.
You do have to be careful.
Yes, you have to be very careful.
Can it damage the veneers or something like that you already have?
It doesn't damage. What it does do, if you have, let's say, a filling on your tooth, it will brighten up your tooth enamel, but not the bonding. So all of a sudden it looks funny, because the tooth part looks nice and white, and the bonding, which matched your teeth before, now it's yellow. So it actually does look funny.
And there are a lot of different places you can go for this. I mean, you can walk down the street, and there are clinics, and there are places where you can walk in. What do you think of that? I
totally disagree with that. And again, if it's not done by dental professions, it's not done correctly. I see a lot of patients that come in, their gum is all burned, their lips are burned, their tongues are burned, and it's just because it wasn't administered correctly. So if you're not a dental profession and they don't know what they're doing, they don't cover the gums correctly, you can really damage them.
So
and
it's a good thing.
And that could stay with you. The damage that you do might last longer than the treatment. It stays with you?
It actually does, yes.
Yeah, so I was going to say, it can be a good thing, but you also have to be very careful.
You have to be very careful. You really should do it at a dental office. It's the best way to do it.
All right. Teeth whitening. Dr. Fajiram, thank you so much for joining us today.
Thank you, Ernie.
It was a pleasure to see you.
My pleasure.
That's great.
Yeah.